Acid reflux is a challenge that some parents have to face with their baby during the first year and sometimes into the second year of life. Acid reflux occurs because the stomach doesn't always hold down the stomach contents and the stomach acid, and sometimes some of it will come up into the throat and cause burning and pain for the young baby. Acid reflux will cause a lot of babies to spit up and regurgitate their feedings sometimes after every feeding. Some clues to acid reflux include spitting up or almost projectile vomiting after every feed, a sour taste in the mouth or some gulping sort of movements that you'll see your baby have, fussing after you feed your baby and you lay your baby down. Sometimes that creates stomach acid and burning up in the throat, and baby will fuss from that and be in pain. Frequent night waking can also be a sign of reflux because when the baby's laying down, there's gravity isn't there to hold the stomach acid down, and it can leak up into the throat and cause frequent night waking. If you feel like your baby is waking up in pain and gulping and swallowing and has a sour smell to his breath, that might be a clue that your baby has reflux. Now there are a lot of things parents can do for reflux. First of all, reflux often occurs because of some sort of food allergies coming through mom's breast milk. If a mom is drinking cow's milk products or eating a lot of wheat products, sometimes soy or corn or nuts or fish, some of these foods the proteins from them can get into the breast milk and irritate baby's stomach and trigger some symptoms of reflux. So any baby who's breastfed, the mom can go off of those foods for a few weeks and see if baby's symptoms improve. Now, if baby is formula fed, he might be allergic to a cow's milk formula. He might be sensitive to the lactose in the formula. If baby's on a soy formula, even that sometimes can cause some allergies and some reflux symptoms. You can talk to your doctor about switching to what's called a hypoallergenic formula, a formula that's much more easy to digest and less likely to cause reflux symptoms. One tool parents can use for reflux is to have your baby sleep a little bit upright at night. Put a pillow underneath the crib or cradle mattress so that your baby is at a slightly upright angle. An ambi-baby motion bed is another tool that you can use for reflux because it allows baby to sleep at a slightly upright angle, and so baby isn't laying flat during the night. Not all reflux is painful or harmful. Some babies are what I call happy spitters. They simply spit up after almost every feeding, but they're as happy as can be. The spitting up doesn't cause any pain. They don't have frequent night waking. They don't seem to ever get a sour taste in their mouth or seem to fuss from a lot of belly pain or throat pain. These happy spitters typically will outgrow their spitting up around 4 months of age, and parents usually don't have to go to any sort of extreme measures or use any medications to calm down this kind of spitting up if baby is really a happy baby and doesn't seem to show any signs of pain.